Is there a difference between an MTM and a care plan? It seems like there's a whole lot of overlap, but are they the same? Could they be the same? Can they be handled the same, I guess, as far as workflow?
So yes and no. So I'll throw out my hot take of the hour and tell you that I think traditional MTM is pure garbage. Like for the most part, medication therapy management is what pharmacists should be doing, right? I don't think anybody questions that. But it has to be timely, right? So if I'm going to do a med reconciliation on you, what's special about October? Nothing. You're 2 months from your plan running out, and you have to have it done once that year. So it's not meaningful, right? If you didn't catch all the drug interactions that you saw for that patient between January and October, you've done no good. All you're doing is billing for that $50 that's required on the Medicare Part D plan. At its core, if MTM was what it should be, it would look a lot more like care planning, right? Same thing with MedSync. You talk to a patient every month, you identify a problem, you document the problem. That's care planning. If you do a tip, for the most part, the tip is just there's a less expensive option, or the patient's not taking the medication correctly, and you're just doing a therapeutic interchange. Pharmacists do that all day, every day, Monday through Friday, sometimes on the weekends. Documenting that is part of the care plan, right? So there's nothing special inherently about saying I do care planning or I send it to whoever I send it to. The special part is being able to document the things that you do that are clinically relevant and timely for a patient when they're done, and the ability to share that with anybody else that can accept that care plan. That's it, right? Just documenting what a good pharmacist does every single day.
Yeah. Yeah, and the thing is, if you think about it, if you're getting tips, especially for your own patients that they're not adherent, if there's serious issues, serious enough that a payer is willing to send that down the chain and spend money in the process to correct an issue that's happening at your pharmacy, it seems like a very reactive approach to patient care.
Mm-hmm. I mean, and the positive part about that is it shows that payers care about those things, right? I mean, having an adherence of 80% may or may not be a good measure of if the medication's working, right? If you take the medication 30% of the time and it works, who cares? If you take it 90% of the time and it doesn't work, you need to be on something different. But what the point of it is there's clear information that patients who take their medications and they take them correctly have better outcomes. And so payers are clearly incentivized to pay for services that make sure patients take their medications on time and correctly. It just so happens that right now MTM and tips are the way that that's their easiest avenue of getting that done. And so if we can give them better avenue with better results, they'll clearly go that path, right? I mean, if I could fix your problem in January and you have 11 months of adherence beyond that, that's better all day than fixing your problem in October and having 2 months until you're on the next plan. And unfortunately, insurances are incentivized to see people as being humans from January to January. And then on January 1, if you're not on that plan anymore, you're not their problem, right? So you have to be proactive about it. And if we can show payers and everybody else that there's a better, more efficient way of doing it, they'll absolutely switch.